We are just a group of professionals who believe in our integrity, and we cannot allow anybody to supplicate us. That is the truth. And for some of them, they feel that because we are very comfortable, and that's why we're able to confront them. And the only way to bring us to our needs is by messing up our emolument or messing up our rights or privileges. So that's exactly the approach that we're using. Yeah, this is just one of the many things that the Lagos State government does. The reality is that we have a lot of laws, especially as it applies to civil servants, that is not being applied appropriately in Lagos State. But over the years, they've been able to silence a lot of civil servants. So people have been demonized that they don't even know when they have a right and when they have a privilege. But for us, over the years, we have tried to streamline those things that are privileges away from those that are our right. And our right is our right, and we'll continue to ask for our right. As of 2008, yes, there's always been interest of government in the leadership of the association, but we have not really had this extreme. By the time people start to question our leadership, our election, and following it up like that, and it continues to get worsened over the year. So we can say that's what has been happening. So you can say the whole thing started from that 2008, and it peaked in 2012, and maybe because we kept quiet after the May salary. Well, we were not really quiet. We just felt we could achieve it by peaceful discussion to get our money back. We had the case in court. Somehow they appealed to us, and we withdraw the case from the court, because as far as we are concerned, you cannot apply a no work no pay rule when there's a strike.
So would it be safe to assume that it was because you decided to be independent of government during your elections that this setting?
Well, that may really be difficult to say outrightly, but it's not impossible, because interest in the leadership of the association are really peaked over the years within the government. You understand? So when a government have a group of people that have refused to submit to them and follow their will, in fact, it's as bad as sometimes when you even have the rule well stated and you confront them with the rule, they believe that you are confronting government. As a civil servant, we are public servants. We are not slaves. We are guided by a rule that is national. That is the public service rule and the civil service rule. And there's a scheme of service. But when you now cite rules from the public service rule, they say, no, that is for federal, not for state. You now go to the civil service rule and look for a relevant law. They say, no, this is what we want to do. So they have a lot of unwritten policies that is being applied at will.
It's okay, government is interested in the leadership of the association, but if they're going to be able to do it, I think there are legal ways to do it, and there are dignified ways to do it. That definitely has been a sore point. And as you know, we have pointed out many issues many times in the past. When they have said, for example, that I pointed out selectiveness in the application of certain things. When it comes to wages, we're here, we can't pay. The federal government can't force it. When it comes to tax, no, that tax cannot be less because the federal government dictates tax. Ideal logic would state that, well, if you cannot pay the federal wage because by your arithmetic it's too much, why would you want to charge federal tax, which increases the tax on that federal wage that you claim is too much, that you cannot pay? Also, there are so many people that are paid, so many sections of the workforce that are paid from the coffers of government. And when government picks out a certain section and says that yes, we are going to pay these people a certain amount, which as far as we are aware, is even higher than what federal has dictated. And when we ask, they tell us, no, these are a group of special people, and there is federalism, and in federalism we can pay what we like. We then ask, okay, you can pay those people, you are practicing federalism, and then you say these people are special. How can you say that? We are not even asking for anything more than federal, we're just asking for what federal pays. You're saying that we are not special. And all those are very, very sore points. But it will be difficult, and I've said this publicly. For example, if everybody, the legislators, the governor, were to say, well, this is what the federal government suggests, or this is what the federal government has directed that so and so should be paid. But in Lagos State, this is what everybody will earn because of our costs. It will be difficult for, you can imagine, for any particular group to say it must, for example, come out of that. But when you single out some people and say, yeah, no, these ones are special, and they're going to be treated specially, what happens to the others? If that is not double standard, I don't know what is.
Any government, Lagos State government that is employing doctors on contracts, the simple way of alleging it is that they are anti-people, they are against the people, they don't want the best for the people, they don't value the lives of Lagosians. That's why you employ a doctor on contract. Most of these people we are talking about do not access our healthcare delivery in Lagos. They live out of they leave the country for other countries like India, even US, UK, for medical treatment, medical tourism. And that is part of what is actually killing this country. When you employ people on contract, these are the kind of things you get. So far that they know that that person they have employed there is on contract basis, they will not want to access that healthcare facility or service. So that's basically the answer to that question. Our leaders are not using the facilities. That's why they are going to that extent of putting people on casualization. Even the governor himself, in about 4 weeks ago, has addressed some people of bankers and have told them that casualization is wrong. So why must you now casualize medical profession?
As a doctor, you have been entrusted with the life of people, and that should be your major focus and concern. By the time you begin to contend with issues that are supposed to make life easier for your practice, it becomes a difficult thing to do. The government and the people of Nigeria, they are quick to make reference to the Hippocratic Oath, which states the commitments, what we swear to as doctors to practice. But they always fail to leave out a part, in which Hippocrates said that I am able to do these things, under a condition that is conducive. I'm able to practice where I am offered the opportunity to live a good life. You understand? So it's a difficult thing to really practice medicine here. We are well trained here, because you see so many of the doctors that are excelling outside the shores of Nigeria are actually Nigerian trained doctors. So how come we go outside and we excel very well, and in our very own continent, in our own Africa, in our own Nigeria, we are not able to do? Because the enabling environment is not there. When a government is committed to its people, when a government is not a spendthrift government, the countries that we run to, to practice are countries that have identified and put a value to human life. Unfortunately, in Nigeria, we have not placed any premium on human life. There's no regard for human life, and that's why you can allow your public hospitals, which cater for more than 80% of your population, to go into rot. For a government that is people-oriented, your vision will be the grassroots. And the health care services that will be provided to those people in the grassroots is a public service. So we have lost it in this country. And because they have lost the focus, it becomes very easy for them to be able to go out. A situation where an ingrowing toenail will be flown to Germany to go and have surgery for ingrowing toenails. Is it not embarrassing? More so that even when they go over there, it's very probable that the people that are going to be offering them those services in the countries that they've gone to are Nigerians trained here. So I don't think the problem is with the training. I think the problem is with governance. The problem is with policies. The problem is with commitments. And I believe that if government begins to tell itself the truth and begins to look inward, how did India get to the point where it is? India is not better than Nigeria in any way, in terms of manpower and all that. But because the government has identified a need and decides, to work on it and provide a leeway for its people, everybody's running to India. The medical practice is not in isolation to the problems of Nigeria, the problems of power, the problems of, the roads and all that. Those things are contributory to the problems that we have. And when we begin to address it, then I see a way forward.
When you talk about caring for people, doctors were sacked. Many of these doctors were people with experience of more than 3 decades. Some of them 5 decades in medicine. And they were sacked and they were replaced. This is a profession where experience is the primary thing. It's not just what you learn in school. Many people, you learn things in school, you go to postgraduate college for another 5, 10 years sometimes, you come out, you continue to learn. Is it possible to replace that kind of experience with that of somebody who graduated 2 years ago? And this was done by this administration in 2012. Is that an administration that cares about its people? Of course not. They don't care.
Kò ní wọ́lá